Hello, and welcome to your stretching for cardiac rehabilitation. You can use these stretches for a cool down after your aerobic exercise or your strength training exercise, or you can just throw in these 10 minutes of stretching because it feels good anytime throughout the day. When we're doing these stretches, it's about 30 seconds is what we're going for. And in that 30 seconds, I want you to concentrate on your breathing. When we inhale, we're going to try and straighten the spine or elongate. And when you exhale, I want you to get a little bit deeper into that stretch. On a scale from 1 to 10, where 1 you're doing nothing, and 10 we're going to rip that muscle right off the bone, we're looking about a 6. We have tension there. It's not a place we want to stay all day, but we can breathe through it. No sharp pain. Let's begin. Sitting in a chair, nice and tall. We're going to roll our shoulders back and down. Concentrate on that rib cage lifting off of the belly. With our head and the shoulders relaxed, we're going to tilt the head to the right. And when you tilt your head to the right, I want you to bring that left arm down. Not that I'll physically see this if I was in the room with you, but as we exhale, I want you to try and pull down through that arm. So as we tilt the head to the side, you'll feel that stretch deepen. No sharp pain. Inhale and exhale. Slowly bring that head back up, and we're going to switch to the other side. Tilting your head to the left. My right hand goes beside my body. Nice deep inhale, sit up a little taller. And when you exhale, we're trying to pull that arm away from the shoulder. Inhale and exhale. Perfect. Coming back to center. Roll the shoulders for me. Try not to move the torso. We are going to sit up nice and tall. Try to keep the chin tucked in towards the chest. And we're going to turn our head and look over our right shoulder. I want you to stay there. Inhale. When you exhale, try and turn that head a little bit more. And then slowly, slowly coming back to center. We don't want to make ourselves dizzy or nauseous here. Just the head is going to look over that left shoulder. I want you to stay in that position. Inhale, sit up a little taller. And when you exhale, try and turn the head a little bit more. Stay there. Inhale. Exhale, try and turn the head just a little bit more. And then coming back to center. Roll the shoulders. If you've had chest surgery, this might not be the stretch for you. You have to ask your surgeon about it, but the goal is a little bit of a chest stretch. So you can do the modified version. My arms are quite low, my elbows are bent, and I'm simply trying to pull my elbows back. We want to feel gentle, gentle stretch in that incision point. No sharp pain of any kind. If you're past 12 weeks, you're good to go, you've been cleared for activity, we can have those arms straight out at about shoulder height, and the goal every time we exhale is to try and pull those arms back a little bit further, sit up taller, deep inhale. Exhale, pull those arms back a little bit further. Exhale. So it might look like this. It might look like this. If you're just starting out, okay, that pressure will be about a 3 or a 4 on a scale. After 12 weeks or even further than that, you can look for about a 6 for this tension. We're going to bring those arms back, roll those shoulders. We stretch out the chest. Let's stretch out the upper back. The goal here, clasp our fingers together, and then we're going to roll those palms so that they face away from us. Try not to collapse the spine like this, okay? We sit up nice and tall, and on our exhale, we're simply trying to pull our arms away from us. When we pull the arms away from us, you'll feel that stretch in the forearms, in the shoulders, maybe in that upper back. Take a nice deep inhale and exhale. The problem is as we try to pull forward, we'll sort of roll like this. So we're fighting against that movement, keeping the spine out of it and just having those shoulders stretch for us. Bending those elbows, releasing those hands. You might want to wiggle those fingers, rolling the shoulders back. Now comes my all-time favorite stretch of all time, the seated cross ankle stretch. On the edge of your chair, we're going to take that right ankle and we're going to cross it over the knee. It might look like this. I want your ankle to be flexed at 90 degrees. Inhale, sit up tall. Think upward, forward thoughts as we lean forward rather than collapsing like this. If we have knee surgery or hip surgery, I know you have restricted movement. I know you can't do external rotation, but you can still probably do this. We still got to get that sock on every morning. So for functional mobility, it might look like this, and we're simply trying to straighten that spine. It might look like this, where we get to lean forward a little bit more, or we might be able to get that knee down. We lean back. Let's switch to that other side. It will be different. Maybe this is the side you had hip surgery or knee surgery, so it might look like this, and the goal is to just try and straighten the spine. With every exhale, we're trying to get a little bit more, a little bit more, a little bit more. Feel that tension. We want to feel the stretch. We have to breathe through that stretch. It's not comfortable, but we do not give ourselves sharp pain. Keep the shoulders relaxed. Inhale and exhale. And then we're going to lean back and we're going to do hamstring stretch. Definitely on the edge of your chair. Do not fall off of your chair here. You want to extend that right leg, heels on the ground, the toe is pulling towards me. Keep the spine nice and straight. It's a broomstick. It cannot bend. I'm going to hip hinge. What this does is it keeps my lower back out of it. We have a tendency to collapse the spine. And if you have any kind of lower back, it hates flexion. You'll injure the spine with flexion. So we keep the spine straight. It will restrict my movement, but I'm still definitely getting that stretch in the back of the leg. Sit back, switch to the other side. Toe is up, spine is straight, hip hinge. Take a nice deep inhale, exhale, try to hip hinge a little bit more. The more you can pull that toe towards you, the deeper you're going to feel that stretch. Breathe. And then we're going to sit back, bend the knee. The quadricep stretch, one of the hardest things to do, and this one is my favorite. Pretend that this is a wall. So it would look like this. Your chair is here and the wall is here. I'm just going to turn this direction so you can see what I'm doing. Do not give yourself a Charlie horse in the hamstring. You're about this far away from the wall. We lean forward so we can kick that foot back and immediately relax it. If you hang out here, you're going to give yourself a Charlie horse. The goal is to get that foot up decently high so we can work on leaning back, straightening the hip. It might look like this. So every time you exhale, straighten, straighten, lean back. Switching to the other side, lean forward so we can kick back. And then you want to try and straighten that hip. Feel the stretch in the quad. I want my shoulders relaxed. I want my spine to be nice and straight. So if it has to be like this or a little bit lower, that's fine. Okay, just watch your knee. You don't want to cause any sharp pain. This is a beautiful stretch, by the way, if you have knee pain or hip pain. Awesome. In the seated position, we're going to stretch out the groin. With the groin, again, it's another hip hinge one, so you got to be careful with your lower back. Want a nice wide stance on the edge of your chair. My spine is straight, and I'm going to hip hinge. I'm going to put my elbows on the inside of my knees. Push away. So when I push my knees away, I'm going to feel the stretch in my groin. Be careful. I don't want you to do this, okay? My spine is straight. My hands are here. My heart is reaching upward and forward. So when I push my knees out, I feel my groin, my inside leg muscles stretch. My back is not curved at all. If you're in this position, now we have a problem. I flattened out my back, okay? We're going to sit back. And then my last one, which is also one of my favorite ones, is you're going to stand up and we're going to use the wall. Your toe is going to be as high as it can go on the wall. My knee is straight. My hip is straight. And I'm going to use this back leg. I'm going to lift my heel. I'm going to push against the wall. So I'll show you here against my couch here. As high as possible, that toe. The knee is straight. And then try and push forward. If you have a really tight calf, it will look like this and it will go no further. So breathe and then just try and, put it into the universe that hopefully eventually it'll get closer and closer. We're going to switch to that other side. Toe is nice and high. Knee is straight. Don't do this. Don't put your face up against the wall. Okay. My hip is straight. It's this back foot that's going to lift off the ground. It's going to help push my whole body forward so my hip can stay straight, and then I can feel that stretch in the bottom of the foot, in the calf, maybe in the back of the knee. If you have severe arthritis in the feet, be gentle with this one. You don't want to make it too mad. Okay? Nice deep inhale, nice deep exhale, and you can release, shaking out those feet. You have stretched out almost every single muscle that really will feel it in the body, and hopefully you enjoyed that. Hopefully it helped with a cool down after your exercise or just made you feel nice and loosey-goosey. Thank you so much for watching. Bye for now.